Hello everyone. In this lecture we are going to discuss about anti-arrhythmic drugs. So in last lecture we have seen what is arrhythmia, which are the different types of arrhythmia, what is the normal physiology of the heart. Okay. So in this lecture we are going to discuss about anti-arrhythmic drugs. Okay, which is a very important point as a as exam point of view. Okay, so arrhythmias are deviation from normal heartbeat pattern. So whatever there is a normal heartbeat pattern is there in the person, so it person to person it changes. So whatever normal heartbeat pattern is there in the person, there is a change in the or deviation in that pattern. So they includes abnormalities of the impulse formation such as heart rate. Okay, that is a change in the heart rate from a change in the heart rate, like increase up in a heart rate more than 100 or decrease in a heart rate less than 60. Okay, then abnormalities in the impulse formation. Okay, or site of impulse origin and conduction disturbances. Okay, which disrupts the normal sequence of atrial and ventricular activation. So this is the definition of arrhythmias. In last lecture we have seen detail about what is what is arrhythmia and related information we have discussed. So cardiac arrhythmias and abnormality of the cardiac rhythm, okay, is called as a cardiac arrhythmia. Arrhythmia may cause sudden death, syncope, heart failure, dizziness, palpitations, or no symptoms at all sometimes. Okay, so there are two main types of arrhythmia. We have seen bradycardia and tachycardia. In bradycardia, the heart rate is slow. Okay, mainly in bradycardia it is less than 60 beats per minute, and in tachycardia the heartbeat is fast, more than 100 beats per minute. So mechanism of arrhythmias, the current understanding of the electrophysiological mechanisms responsible for the origin of perpetuations of cardiac arrhythmias is that they are due to the altered impulse formation, that is change in atomicity, then altered conduction or both. Sometimes there is a change in atomicity, sometimes there is a change in a or alteration in the conduction, and sometimes maybe arrhythmia is formed due to both the reason, so acting simultaneously from different locations of the heart. The generation of the cardiac impulse in the normal heart is usually confined to specialized issue that spontaneously depolarize and initiate the action potential. So the cells are located in the right atrium and are referred to as SA node or the pacemaker cell. Okay, we have discussed that SA node is the pacemaker of the cell, which is having the ability to generate action potential. So although the spontaneous electrical depolarization of the SA pacemaker cells is independent of the nervous system, so these cells are inverted by both sympathetic and parasympathetic fibers, which may cause an increase or decrease of the heart rate respectively. So arrhythmic agents or antiarrhythmic agents are a group of pharmaceuticals that are used to suppress abnormal rhythm of the heart. So this is an important point related to antiarrhythmic agent. So in arrhythmia there is a change in the rhythm of the heart. So the whatever drugs are prescribed to treat arrhythmia are known as an antiarrhythmic agent. So antiarrhythmic agents are a group of pharmaceuticals that are used to suppress the abnormal rhythm. So whatever abnormal rhythm is there in the patient, there is a suppress in that abnormal rhythm of the heart, that is cardiac arrhythmias such as atrial fibrillation, atrial flutter, ventricular tachycardia and ventricular fibrillation. Okay, so to treat mainly arrhythmia, that is to treat the abnormal rhythm of the heart, this type of drugs are prescribed. So this is an action potential. Okay, this is a normal action potential in the normal healthy human being. Okay, so initially it is a depolarization phase, opening of voltage gated sodium channel. So we have seen that change in the action potential in the resting membrane potential, it is positive charge is present outside the membrane and negative charge present inside the membrane. So due to the opening of the sodium ion channels, okay, that is voltage gated sodium ion channels opening, so more amount of sodium ions enter inside the cell. So due to the entry of the positively charged ions inside the cell, whatever positive charge is present outside the membrane is decreases, okay, and that is the initial stage of generation of action potential, and is known as a depolarization. Then repolarization, that is closing of sodium and opening of potassium voltage gated channels. So after that, mainly in the repolarization, there is a closing of sodium ions and opening of potassium, okay. Then hyperpolarization, voltage gated potassium channels remains after open after the potential reaches resting level, okay. So this is action potential, how it's generated due to the opening of potassium, then there is a closing of potassium, then opening of then there is a opening of sodium, and initially in the depolarization there is a opening of sodium ion channels, then in repolarization there is a closing of sodium ion channels, then opening of potassium ions, and in hyperpolarization voltage gated potassium channels remains open after the potential reaches resting level, okay. So these are the important point related to the action potential. So anti-arrhythmia, so anti-arrhythmic drugs which are used, mainly there are 4 classes: class 1, class 2, class 3 and class 4. So class 1 anti-arrhythmic drugs are sodium channel blockers, okay. So that class 1 drugs mainly effective at sodium channel. Then class 2 are beta blockers, class 3 are potassium channel blockers, and class 4 are calcium channel blockers, okay. So mainly in phase 0 there is a depolarization phase, means opening of sodium ion channels. So whenever we prescribe any class 1 antiarrhythmic drug, that class 1 antiarrhythmic drug is active at sodium ion channels, and if there is a change in the normal rhythm of the heart, okay, then this type of drugs are prescribed, like class 1 that directly act on sodium channels and blocks the sodium channels, okay. So whatever they produces change in the phase 0 and phase 1, so in person having the change in the heartbeat rhythm, then this type of drugs are prescribed. So they are used to regulate the normal heartbeat or normal rhythm of the heart, okay. So these are the important subclasses of the antiarrhythmic agents: class 1, class 2, class 3 and class 4, and the receptors on which they are active. So all drugs are blockers. Initial class 1 is sodium channel blockers, class 2 is beta blocker, class 3 is potassium channel blockers, and class 4 is calcium channel blocker, okay. So these are the slopes, or these are the action potential. So due to the administration of the drugs, mainly class 1 antiarrhythmic drugs, so due to that there is a change in the generation of action potential, there is a change in the slope or graph, okay, whatever generated in the previously without presence of 1A or without presence of 1B, 1C. These are the subclasses of class 1 antiarrhythmic drugs. So class 1 antiarrhythmic drug is subdivided into 1A, 1B and 1C, and due to the administration of the drug there is a change in the action potential which is required for normalizing the rhythm of the heart. So these are the important intervals like P wave, then PR interval, QRS complex, ST segment and T wave. These are the important factors in the electrocardiogram. So whenever initially P wave, you must know about what is electrocardiogram. So in the electrocardiogram you will find P wave, and that P wave is the depolarization of the atria in response to SA node triggering, Okay, so once the action potential generated in the SA node, there is a formation of P wave. Okay, and that is due to the depolarization of atria in response to SA node triggering. Okay, so initially it is generation of action potential. Then next one is PR interval. Okay, so that PR interval is delay of AV node to allow filling of ventricles. Okay, so once there is a contraction of atria, there is entry of blood from atria to ventricle. Okay, so delay of AV node to allow the filling of ventricles, specific time interval is required for filling of the ventricles. Okay, then QRS complex, the depolarization of ventricles triggering main pumping contractions. Okay, that is a QRS complex. Then T wave is a ventricular repolarization. Okay, and ST segment is the beginning of ventricle repolarization should be flat. So these are the important information related to the electrocardiogram. So now we are going to see different classes of antiarrhythmic drugs. Antiarrhythmic drugs can be placed into 4 separate classes based on their mechanism of action or pattern of electrophysiological effects produced on the heart. Okay. So these are the 4 important classes: class 1, class 2, class 3 and class 4. So class 1, just now we have seen sodium channel blockers. So they are subdivided into class 1A, class 1B and class 1C. Okay, so all 3 subclasses are effective at sodium channel, but class 1A blocks sodium channels and prolongs the action potential, whereas class 1B blocks sodium channel and shorten the action potential. Class 1C blocks sodium channels with no effect on action potential. Okay, so this is a slight difference in their mechanisms, but all are effective at sodium ion channel and they blocks the sodium ion channel. Then class 2 is a beta blocker, class 3 is a potassium channel blockers and class 4 is a calcium channel blocker. Okay, so class 1A, which is a sodium channel blockers, slows the phase 0 depolarization. This is the important relation between phases and the drugs on which they are effective. So mainly 1A, class 1A antiarrhythmic agent is active against sodium channel blockers, or they are active against sodium channels. Then it slows the phase 0 depolarization. 1B shortens the phase 3 repolarization. 1C markedly slows phase 0 depolarization. Then phase 2 beta adrenoreceptor blockers suppresses phase 4 depolarization, whereas class 3 antiarrhythmic agents are potassium channel blockers, prolongs the phase 3 repolarization, and phase 4 are calcium channel blockers, shortens the action potential. Okay, so these are the important point related to the classification of drugs and on which phases there is a change due to the administration of the drug and what is the mechanism behind each and every class. So just now we have seen mechanisms and comments also we have seen. Okay, there are specific side effects are formed due to drugs. Okay, so mainly 1A, the examples are quinidine and procainamide, which are active against sodium ion channels and blocks the sodium ion channel. 1B and 1C both are active against sodium ion channels. The examples of 1B antiarrhythmic agents are lidocaine, phenytoin, class 1C, flecainide, propafenone. Then beta blockers are propanolol, esmolol and atenolol. Potassium channel blockers are sotalol and amiodarone. Calcium channel blockers are diltiazem, and other unknown mechanisms, direct nodal inhibitions like magnesium sulfate and digoxin. So it is the largest class of antiarrhythmic drug. Mainly class 1 is the largest class of antiarrhythmic drug. So class 1 antiarrhythmic drug act by blocking voltage sensitive sodium ion channel. This drug bind to the sodium channels when the channels are open and in activated state, and dissociate when the channels are in resting phase. Okay, so inhibition of the sodium channel decreases rate of rise of phase 0 of cardiac membrane action potential and slowing of conduction velocity. So they also block potassium channels, thus slows the repolarization in ventricular tissues. So along with sodium ion channel, they bind to potassium channel also and blocks the channels and inhibits the action potential generation for specific time interval. So these drugs have local anesthetic activity and may suppress myocardial contraction forces. So these effects are observed at high plasma concentration. So this is a mechanism of action for the antiarrhythmic drugs, that this drug act on sodium ion channels. Okay, then that blocks the sodium channel, reduces the rate and magnitude of depolarization and decreased CV in non-nodal cardiac tissue. So this is a mechanism by which there is a decrease in a CV in non-nodal cardiac tissue. So just now we have seen three subclasses of class 1, class 1A, class 1B and class 1C. So 1A is a moderate sodium channel blockers, whereas 1B is mild sodium channel blocker and 1C is a marked sodium channel blocker. First one is 1A, that slows the rate of rise of phase 0, then 1B limited effect on phase 0 and 1C having markedly reduced rate of rise of phase 0. So 1A prolongs the refractoriness by blocking several type of potassium channels, little effect on refractoriness as there is a minimal effects on potassium channels. Then 1C prolongs the refractoriness by blocking delayed rectifier potassium channels. Okay, so these are the important points related to 1A, 1B and 1C. Okay, so these are the examples and the action potential. Ventricular action potential which is generated due to the presence of 1A, 1B and 1C, which is given in green, red and blue color, and black is in healthy person. Okay, normal impulse or action potential. So these are the change in the action potential due to the presence of class 1A drug, class 1B and class 1C drug. So mainly this drug enter into the cell, then they binds to the sodium channel. Okay, and due to the binding of sodium channel, it blocks that channel and decreases phase 0 upstroke velocity, decreases conduction velocity. Okay, so this is a main mechanism by which anti-arrhythmic agents shows their action. Okay, so in they may ask for 2 mark what is the mechanism of action for antiarrhythmic agent. Mainly, what is the mechanism of action for class 1 antiarrhythmic agent, or class 2 or class 3 or class 4. So important point related to the mechanism is type of receptor on which they are effective. Okay, then it produces antagonistic effect, it produces the effect by blocking the receptor. Okay, as all class 1, class 2, class 3 and class 4 are blockers. Okay, so mainly there are three subtypes of class 1 antiarrhythmic agent like class 1A, class 1B and class 1C. Okay, so there is a slight difference in their mechanism of action. Okay, so each and every drug under the 4 classes, that is class 1, class 2, class 3 and class 4, we will see in next lecture. Thank you.